Hello, I'm Dr. Vinay Dheer and I'm the chairman of the Institute of Digestive and Liver Care at SL Raheja Hospital, Mumbai. Today we will be talking about digestive wellness or digestive health. Digestive health is not a new concept. It has been around since ages. Our forefathers used to always tell us to bother about our digestion. A healthy set of bowels is a cause for long life and a healthy life. That is what used to be told. However, over the past 3 or 4 decades, our lifestyle has changed. The pace of life has increased dramatically. We are working harder, we are sleeping less, we are not eating on time, and that has changed our digestive wellness. Particularly over the past 8 or 9 months, as you are all aware, we all over the world have suffered the effects of the COVID-19 pandemic. Our lifestyles have completely changed. We are homebound. Our food has become different. Our communications have become different, and it has become a drastically new lifestyle. No wonder then that there are lots of patients who are having gastrointestinal complaints like acidity, gas, bloating, pain in abdomens, loose motions or constipation. Now these problems are otherwise also very common. About a third of our nation's people suffer from these problems at one time or the other, and most of them are related to lifestyle. So what should we do about these problems while we are still dealing with the COVID pandemics? We have to ask ourselves a few questions which I will tell you. So the first question you should ask yourself is, what are you eating? So our forefathers and of course the science tells us that we have to eat in moderation and we have to eat a balanced diet. Have we been doing that? In the last few decades, you see the diet has changed and we are eating more refined food. Taste has taken precedence over nutrition. So we are eating more refined food, we are eating spicy food, we are eating oily food, and our digestive system is not built to handle that. So that is the first question we have to ask ourselves. Are we eating a balanced diet? Are there enough fruits in our diets? Are there enough greens in our diet? Are we eating at particular time intervals? And the second question that you should ask is, how much are you eating? Our body is a wonderful machine and it knows how much is enough, and usually it gives us a signal that enough, now we should stop eating. However, as the foods currently have become very tasty, we often ignore body's signals and we tend to eat more. Our body still handles it very well if there are small amounts eaten infrequently. But if we are eating large amounts every day, body is incapable of handling it. And what it does is it converts all these extra calories into fat, and the fat then deposits into all parts of our body: heart, arteries, liver, kidneys, and all the other areas, which has long-term consequences on our health, and our health starts to deteriorate. Non-alcoholic fatty liver disease is a major digestive problem nowadays, and it is primarily because of our diet. The third question we should ask ourselves is, are we respecting our body? How do you respect your body? Is by giving it activity. How much activity are we doing in a day? We are all very busy. Early in the morning we get up and rush for work, come late at night and then eat and sleep. So this is not how body is able to going to sustain itself. What you need to do is to think that if we are able to do exercise, moderate exercise, some walks, 20 minutes a day, 20 minutes alternately. So about 1.5 hours in a week of moderate activity is going on. Then the calories that you are eating will get absorbed properly and there will be no fat deposition and there will be no side effects. So we have to respect our body and we have to give it activity, we have to give it exercise. The fourth question you should ask for your digestive wellness is, are we taking care of our mind? Again, due to hectic lifestyles, we are so busy in our work and in our activities that we forget our friends, we forget our families, and we forget ourselves. So it is important that you set aside some time for your friends, for your family, and for yourself. A daily meditation schedule, not more, about 10 to 15 minutes a day, and you will start seeing that the body is happy, the mind is happy, and you are able to perform better. So please take care of your mind also. And finally, you have to always remember that there is always help around. We are always there at Raja Hospital, at Idlcare. There are other doctors also, excellent doctors, who will take care of you in points where you are not feeling good. So if you have a problem which lasts for more than 2 or 3 or 4 days, please do not hesitate to consult your doctor. Go to him and let him find out what it is. In all probabilities it will be nothing, but it is better to seek advice early rather than late. We are always there for you, but